informed and inspired to think outside the box. I'm Tamara Stuchlak, and in this segment, we explore new approaches to vision care, treatment, and therapy. With us is Dr. Michael Bermel. He's an optometrist. He has 4 offices in the greater Northern Virginia region. Thank you so much, Dr. Bermel, for being with us, and we're very excited to hear about some highly interesting new techniques that you use in vision care and vision therapy. But let's start out with your background in optometry and what brought you to this profession.
Well, it's quite interesting. Usually the big decisions were easy for me in my life. The smaller ones were a little bit tougher. Optometry was quite easy for me. I wasn't sure. I knew I wanted to help people, and I went to visit lawyers and dentists and different types of doctors. And optometrists are always the happiest, and they always took me to lunch. And back then,
you observed this?
I observed this.
Very profoundly.
Very profoundly. They're very happy. For the dentists out there, I apologize, but at the time, they had the highest suicide rate and the highest divorce rate. I didn't want that. And optometrists were just very happy and very pleased with the amount of benefit, the ways they could help their patients. And I really liked that. And I guess maybe it was, I'm really glad I went into the profession. Very pleased with that.
So your course of study included what?
Well, in optometry, we go to 4 years of college, and then we also do 4 years of optometry school. And during the third, some of the things that really shaped me as the way I practice. I'm a perfectionist, and when I was in my third year in dental school, medical school, or optometry school, you have scribes. They take notes for the whole class. And the professor was Dr. Larry Gray. He was a neurooptometrist. And he actually was very good. He used to teach the medical students at Hana Medical School. And while I was scribing for the class, we took notes for the whole class. My 2 cousins from Illinois came to visit me. And their cousin, which is my second cousin, and my one cousin, Chuck, had been diagnosed with migraines. And in the first 3 days, we do what normal guys do. We go out and just kind of enjoy each other's company. And the third day, I remember sitting Chuck down in this big blue chair I got at a yard sale. I'm saying, Chuck, let me check your eyes. And within a few minutes, I thought he had a midbrain tumor. He had been diagnosed. You see numerous ophthalmologists, numerous optometrists, more neurologists, more ophthalmologists, more optometrists.
From your training, that's where a diagnosis can lead?
Yes, you could tell pretty quickly within a few minutes he had a midbrain tumor, and referred to Dr. Gray, and he agreed, and we both thought it was a pinealoma. Some people call it pinealoma. And we went to Hahnemann Medical School, and sure enough, on the CAT scan, this is a ways back now. This goes back to in the early 1980s. His brain tumor showed up, and I was quite sensitive and quite a perfectionist then, but it really went ahead and solidified that you really have to look at everything, and you can always look at a fresh approach to looking at any type of health issue.
But was your training unique? Your optometry training unique, or is that across the board, or again the way that you've delved into your profession? Because we're making distinctions here.
Well, probably both. I made a real effort during our internships to go to different. I went to 3 different VA hospitals, and I went to Haiti for some goodwill work. It's called SOSH, Student Optometric Service to Haiti. That was quite rewarding. I did visual therapy in Florida, which was kind of interesting because the doctor that I was with was considered a bit neurotic. It turned out sometimes neurotic doctors were just ahead of their time. And so I did visual therapy with him, and I also did low vision at the Feinboom Low Vision Clinic in Philadelphia. And maybe you remember that show. I think That's Incredible. Remember that? It's an old show. You're probably a lot younger than I am. But it used to
Thank you for that, but I'm not.
I don't know. But it's a show That's Incredible, and they would have different segments, and the low vision clinic was featured there for a lens called the Honey Bee lens. But make a long story short, basically I tried to delve into different aspects of eye care, low vision, which is helping correct people who cannot be helped with surgery, eyeglasses or contacts, but they need special telescopic lens and microscopes to function. We did visual therapy. We did a number of rotations at the VA hospitals. And
so you have a vast and in-depth range of clientele and patients that you've worked with that you bring to your practices and your offices, including vision therapy, vision care, and this molding process that we want to talk about.
Molding is quite phenomenal, yes. You know, you have to sort of you have to, you know, some things are common sense. You can look at molding and you can see that it works. And we also have a couple other things about molding too. Molding, would you like me to get into what molding
Please.
is? Basically, molding is the science and art of reshaping the front of your eye, so you don't need glasses or
without surgery.
Without surgery, and you can eliminate the need for glasses or drastically reduce the need for it.
How long has this been available, and why isn't this knowledge more widespread or more optometrists offering it?
Well,
versus Lasik.
Well, the evolution of Ortho-K, which general molding is also known as Ortho-K, has been very interesting. When I first got to school, I was very interested, and back then, there's a diagram of the eye, but basically the front of the eye is called the cornea. And the cornea is the main focusing mechanism for the eye. There are other focusing mechanisms, but that's the main one. And what really
point to the focal.
To the back of the eye. So basically when someone has a prescription, it's the distance and the focus that's actually on the retina from the cornea. There's some things in between called the lens, which helps your focusing for up close. But basically, your cornea is one of the biggest factors in how you focus. That's where LASIK occurs. They actually do laser on that part of the eye and actually thins your cornea. Quite frankly, it makes it a little bit weaker. But LASIK has some good points to it also, which we can discuss at another time. But what molding does, it reshapes the front of the eye like a laser. In fact, I did bring some sheets over here to show how it does do that on the front of the eye.
Why wouldn't it be more popular if it doesn't involve surgery, and can it get the same results or better? Or is it more specific to the patient?
Well, it's better is an interesting word. I think better. LASIK has improved a lot over the years. They have different techniques for different lasers, different ways of refractive surgery. One is LASIK, and they use a flap, and they have another way of making that flap now, which is a lot better. The molding, most of the patients in our office, we talk about both the LASIK and the molding.
Would you try the molding first? I mean, it's a...
Yes, I'd have to say that we're rather unique. When patients have the choice, and we are quite trained in, we have a lot of experience in the molding, I'd say 98%, and I'm sure my fellow colleagues who are involved with laser it's something that is not as well known as the laser, I agree. We do about 98% molding versus LASIK when people know the two options.
And what specifically do? You know, you put in contacts at night for how long, and how long does it take to get a benefit?
The molding is where you actually reshape the front of the eye, just like laser. In fact, if you take a map of the eye, which after LASIK and after molding, they look almost identical. I mean, it's amazing. It does the same thing that the laser does without surgery. So what you do, for instance, depending on, with nearsightedness, the cornea is actually too curved. So we push...
Nearsighted, you can see near.
Exactly, right. And so that, or called myopia. Mm-hmm. So in myopia or nearsightedness, we actually push on the front of the eye with a very custom-made lens. To make a long story...
Because a person cannot see far away. They can't see near, so you're helping shape the cornea.
In myopia or nearsightedness, light focuses in front of the back of the retina. And you can help that by, like LASIK does, making the front of the eye flatter. Okay, so it pushes light back further. And
so you put in a contact-like device. Is it specially formed for each person, and how long do you have to wear this?
Well, you might have to give a little history on this. The molding years ago was very archaic. We actually just pushed in the eye and the cornea went everywhere. Back then we only had something called a keratometer. It only measures 3 points of the eye. Nowadays, we have a very sophisticated computer called a Corneal Topographer. and this measures 8,000 or more points of the eye. This has enabled us with sophisticated computer lathes to actually customize a fit for this eye with 8,000 points that we can watch as we fit it with these special lenses.
And so this contact that's been specially prepared, you put it in at night, you just wear it at night for how long? And does your eye then need booster sessions?
Basically, the way I describe it to our patients, like braces on your teeth. And it has remarkable results. We do it for nearsightedness. We do off-label for hyperopia or farsightedness. We also do it for astigmatism. We also do it for bifocals. It's actually a phenomenal effect for reading.
What if you have a couple conditions? You know, need bifocals, can see up close but not far away, and might have a little astigmatism. With those 8,000 points of data, does that?
Oh yeah, we had a patient today that we're correcting. She has 4 in her family, including herself. We're doing the molding, and she has all of them. Nearsightedness, astigmatism, and presbyopia, which is unable to read too well. So, you know,
this is remarkable.
Well, it is remarkable. And what's even better about it, it's actually been proven. I was a little frustrated years ago. There was a news article on us in the paper in 1999. I definitely look younger in the picture. And there's a patient in there that comes in regularly for his follow-ups. And I got a little frustrated in the interview. Not really, but this molding technique actually slows down the eyes getting worse. It's the only proven way to actually stop or slow the eyes from getting worse, particularly in children.
So, Dr. Brunel, we're coming to a close for this portion of the segment, and we're going to go to a break, but we'll be very fascinated to come back and hear more about your vision care that's new advances.
Thank you.
We'll be right back. Let's get a little bit back into how it works and its design, just a little bit back into that, since it's a new technology, a new invention, a disruptive technology. Talk a little bit about that.
That's the exciting thing. With a simple set of LEDs, it issues narrow beams out and looks for a reflection back. So it directly draws a shape map of the hand. It draws the shape of the hand and tracks it in real time. So anywhere within the comfortable field of motion, it's detecting your hand for buttons or for cursor pointing. It also tracks hand motion with accelerometers and gyroscopes to enable cursor motion or cursor control.
And I want to add one thing so that people understand what he actually did that was so revolutionary. There used to be, it was called optical beam interruption. And so when you would put something in the middle there, you'd have to have electronics on both sides. And so when you put something in, the sensor over here would go, oh, I know there's a finger there because it's not
Two-way communication.
Two-way. So what he realized is, well, if you put everything in one place, you would not need electronics on both sides, and it would just bounce off of it and back. It's called optical beam reflectance. So it's reflecting back rather than interrupting. So that was the huge aha moment.
And because it issues its own lights, it's not dependent upon ambient lighting.
Or cameras pointing at you
Right.
or anything like that. So it's kind
Travels with the hand.
Right.
The hands are free to be in a comfortable position to change over the course of use, and it travels with the user. So as we do ordinary day-to-day things like rifling papers or drinking coffee or what have you, you don't have to let go of the control device.
From the nation's capital, welcome back to Your Source TV. With us is Dr. Michael Bermel. He's an optometrist who's using some very unique and advanced approaches to vision care, and we've been talking about a new technique for cornea reshaping. It's called gentle molding. And Dr. Bermel, if you could just give a few more specifics about how it is for a patient, what they have to do for how long, and maybe the differences in cost between cutting techniques of Lasik versus this non-surgical technique.
Sure. If I was to put this, talk about gentle molding ortho-K in a nutshell to a patient or a parent, basically it's a non-surgical, non-permanent way of changing your eyesight so you can eliminate need for glasses or drastically reduce it. There are some advantages over Lasik. It is non-permanent, so therefore you can change the prescription. There's no scarring. It's same sort of risk as you would wear if you wear contact lenses. Basically, there are some real advantages too. It has a drastic effect on slowing or stopping someone's eyes from getting worse for nearsightedness, and they've actually finally proven this in a number of studies. That's pretty phenomenal. A lot of
Lasik does not?
Lasik does nothing to stop your eyes from getting worse.
Wow.
In fact, it keeps getting worse at the same rate. It does nothing to stop the eyes from getting worse. Molding, if you stop wearing it, your eyes will go back to that prescription, but it won't get worse, or if it does, not as much as it would have.
Do you wear it every night?
Well, it depends. We have some patients who have a prescription which you might think is high. -2 is when someone has a difficulty. It's a -2 sphere. That means someone's a certain amount of nearsightedness, and some of you out there may know what a -2 is when you look in your kind of lens boxes. But some of those people cannot even read the big E. Well, we have about a -2 change on average the first day. The most has been what I call a -5. A -5 can't see much past this from your face in one day. Pretty phenomenal. Now, the first night that may wear off a little bit in a -2, but within an average of 2 or 3 nights, that's holding all day.
Is it uncomfortable to wear them?
No, they're phenomenally comfortable, and one of the reasons is because when you wear them at night, they sit in this mold. And after you wear them a few times, they actually sit in that mold, and some people claim they sleep better. It's kind of, maybe it's like a Pavlov dog. They know they have to sleep when the lens is in, but no, they're very comfortable. We do some extremely high prescriptions, and we have some people actually doing the molding on purpose